and welcome to the first Be in the Know, a series where we host informative conversations with clinical leaders, providers, and innovators on relevant and timely topics. I'm Beth Schachtele.
And I'm Marion Troise, and today's topic focuses on healthcare in the community. Today, we graciously welcome Deborah Visconi, President and CEO of Bergen Newbridge Medical Center, located in Paramus, New Jersey. Bergen Newbridge is a clinical affiliate of Rutgers and the largest hospital in the state of New Jersey. It's a full-service hospital with over 1,000 general, behavioral, and long-term care beds, and offers over 26 medical specialties in its ambulatory care center, a leading provider of COVID-19 testing, vaccinations, and therapeutics. And Bergen Newbridge is one of only 115 hospitals nationwide to be recognized as a leapfrog top hospital, with only 5% of eligible hospitals earning this prestigious honor. Additionally, Bergen Newbridge is also recognized for being a top teaching hospital. Debbie, we are very excited to have you join us today. Welcome.
Thank you, Marion. Thank you, Beth. It's really a privilege to be on this program with you, and it's great to be the first speaker and be in the know. So thank you for having me.
Thank you. To start us off, please share some of Bergen Newbridge's accomplishments in 2022.
Sure. So that's going to be hard to do in a short series, but I think what I like to talk with you about is focus on what I call the 5 pillars of success for our organization and what we've accomplished in each of those pillars. So we'll start with our quality and safety pillar. And as you noted in the introduction, one of the really proud moments for this organization is to be a leapfrog A hospital. Having received our second A score in a row, 2 years in a row, as something that the clinical team and the entire administrative team is extraordinarily proud of. That, going along with top teaching and top hospital recognized by Leapfrog, is also an incredibly important and proud accomplishment for us under our quality pillar. Additionally, this year, we have received top nursing home by Newsweek, which surveys thousands of nursing homes and long-term care facilities across the country, and only a handful are recognized with this designation. So those are 2 really proud accomplishments under our quality pillar. Under our access pillar, which is being able to have our doors and programs open to our communities, we have done a number of innovative programs addressing the needs of our community. And of note, I can tell you that we opened the Center for Hope and Resiliency, which is a direct response to the critical epidemic that we're facing with the youth and adolescents in our communities suffering from mental health and behavioral health crises. And this center, opening the doors in this center was the right thing to do for our community to help the children. And the other program that we opened this year in direct response to our community needs is our Eating Disorder Center. And you may or may not know that eating disorders is the second leading cause of death for people suffering from mental and behavioral health disorders, second only to opioid overdoses. So a significant increase in our community of those suffering with eating disorders. And so Bergen Newbridge once again stepped up to the plate to provide access to those critical programs. Additionally, under our growth pillar, that's an area where we're always looking for ways where we can continue to grow our services so that we can provide services and programs for our communities that are very much in need. So we upgraded our ambulatory surgery center, for example, to a state-of-the-art center that rivaled anybody in the community. We are expanding our clinical programs and bringing in new providers. We have a new orthopedic surgeon that has joined our staff. So, continuously upgrading our programs, our providers to provide access and to grow our programs. The next one is around excellence, engagement, if you will, and making sure that when anyone enters our organization, no matter where we are, that the experience is extraordinary, that is compassionate, kind, and equitable. And we've achieved a lot of really great results as our focus on this pillar continues to go throughout the organization. No matter where you go and you encounter a Bergen Newbridge Medical Center staff member or provider, you will get extraordinarily compassionate, quality care. And the last one is our financial pillar. And really, in order to stay in our community continue to stay in our community for another 100 years, let's put it that way, you have to be a financially stable organization. And our financials have really demonstrated that we are a very strong and sustainable organization.
Wonderful. So we know that there's a lot of projects going on here at Bergen Newbridge. What are the healthcare decisions that really drive those decisions?
So we utilize the community health needs assessment as the guiding principles for our strategic plan and the investments we make in our organization and in our programs. The community health needs assessment, we just unveiled the 2022, which is currently available on our website. If you're interested to go take a look at it, was a robust, months-long process of looking at the healthcare needs of our community. Well over 1,000 people and stakeholders were included as part of the process to engage and find out what the needs of those individuals and communities are. And that rolls up into a very comprehensive assessment and report. And that's a living, breathing document for us here at Bergen Newbridge Medical Center. We analyze everything, we identify the needs, and we step up to meet those needs for our communities.
Thank you. And what are the current projects that address these needs of the community?
So there's a lot going on for us, not just within the walls of the hospital, but it is our position that as a vital healthcare asset for our county and our state, we need to go beyond the walls of our hospital to be able to address those communities that are in need of healthcare access. And so one of the major projects that we've rolled out this year is the implementation of Care Right Now. And Care Right Now is a partnership between Bergen Newbridge Medical Center and the Insera family, the ShopRite chain of supermarkets in our communities. And we strategically are placing Care Right Now facilities in specific ShopRites in our community. We've also continued to expand our community health and outreach programs beyond Care Right Now, which are primary care practices. We also continue to have our community health teams go out into our communities, identifying those communities of vulnerability, communities of color, communities that need access to healthcare, and we send our teams out directly into the communities. And whether they are through faith communities or through government communities, through our county partnerships, we are out in the communities with our vans, with our healthcare providers, vaccinating, testing, providing healthcare screening. So we are on the ground wherever and whenever our communities need us.
Great. So tell us, what are these Care Right Nows? You know, where are they? What services do they offer? And how do they address the healthcare needs of the community?
So Care Right Now is essentially a primary care practice. We have primary care providers and other health professionals that work out of these sites. And anyone they're walk-ins, or you can schedule an appointment. And they have accessible hours for our communities because we know that people work or go to school and may not always be available during the day. So we have evening and weekend hours as well. And basically, it's any care that you need. So you can utilize our Care Right Now providers as your primary care provider. You can utilize us for sick visits. You can utilize those locations for school physicals or sports physicals or dance school physicals that your children may need. So we are caring for pretty much everybody, from children to geriatrics. So we cover all populations within the Care Right Now locations. And they are currently, we've opened two. The first one was in Wallington, in the ShopRite in Wallington, New Jersey. And the second most recent one was in New Milford. And we have plans to open another 4 in the next year rolling forward. So we're looking at possibly in Hackensack, Lodi, Hillsdale, Garfield, Palisades Park, for example. And you asked me about, how do we choose where they go? We look at where the needs are. We look at where the populations live. We look at where there's potentially lack of access to healthcare in a particular location. And so we strategically combine the Insera locations with our community health needs assessment and determine where we're going to open the locations.
And what's the overall vision for the care right now, and what's in store going forward once, more open and things like that?
So the vision was to provide care to the community when and where they need it. And when I first came up with this idea, was the point that I was really, the vision that I had was that, to target families, working families, single parents, elderly people that live alone, and you have to make one trip out of your house. You're going to want to go to buy food. That's just what your priority will be. So if you're making that one trip out of the house and you're going to go to a supermarket, wouldn't it be amazing if right in your supermarket you can get high quality healthcare? If your child is sick, if you need a vaccine, if you need a physical, if you just need a checkup, if it's all right there under one roof. You take your transportation to the ShopRite once, you get out of your car, you get out of the bus, you go into ShopRite, you do your food shopping, and you get to see a provider. It was really about convenience and reaching our communities where they are.
So being in the communities in multiple locations over the next couple of years, what health outcomes would you like to see improved in that CHNA in 2025 when they do it again?
I would hope that we're going to see improved chronic care. One of the things that was high priority at this year's Community Health Needs Assessment was chronic conditions. People that have asthma, diabetes, hypertension, mental health disorders, addictions. We would hope to see a change in those statistics and those metrics. We would love to see more people having access to these services and taking advantage of preventative care services and screenings and medications that people may need. And then us being a safety net provider, we want to be sure that everyone has equal, equitable access to healthcare. And that's really been our priority, to assure that those populations, those communities that need the care, that need access to care, have it available to them when and where they need it.
Great. Well, unfortunately, that's all the time that we have, but we wanted to say thank you so much for joining us, Debbie. We really appreciate everything, being here and answering all these questions for us. We would like also to thank the Foundation at Bergen Newbridge and everyone that supports the fundraising efforts to advance the mission to enhance community health and well-being by providing high-quality, compassionate care that is acceptable to those in need. We welcome you to like, follow, and subscribe on all social media platforms, including LinkedIn, Facebook, Twitter, Instagram, and on our website, newbridgehealth.org. We want to thank all of the viewers for joining us, and a special thank you to you, Debbie, for your passion and dedication to the great work that you do for our communities and for Bergen Newbridge.
Well, it's a privilege to be here today. Thank you for having me on, and thank you to all our viewers for listening and choosing Bergen Newbridge for your care.
Thanks, Debbie.
Thank you.